Today let's discuss about the new anti-COVID drug 2-deoxy-D-glucose. So what is 2-deoxy-D-glucose? Is it a new drug? No. It is not a novel drug. It is already in use for cancer patients and it also has its diagnostic use in PET scan. So let's see the use of this drug in coronavirus patients. So 2-deoxy-D-glucose is a glucose molecule which has two hydroxy group replaced by hydrogen. Okay, so that what happens, there is structural change leading to inhibition of glycolysis. It acts to competitively inhibit the production of glucose 6-phosphate at the phosphoisomerase level. So here can you see, this is a glucose molecule. This OH group is replaced by your hydrogen here. Okay, so this is 2-deoxy-glucose. Now what happens, through the GLUT transporters, the glucose is entering into your cell and it is converted to glucose 6-phosphate here and further to pyruvate and then lactate, and then there is production of ATP. This is what happens generally, usually. Okay, so what happens when you give 2-deoxy-glucose, there is conversion of 2-D-glucose to phosphatase. Okay, 2-D-glucose 6-phosphate is produced by the enzyme hexokinase, but further conversion to pyruvate and lactate is not happening, and at this step your glycolysis is inhibited. So what happens, there is no production of energy. When there is no energy, the viral infected cells will be dying. So the alternative names of 2-deoxy-glucose are 2-deoxy-glucose, 2-deoxy-mannose, deoxyarabinose hexose and 2-DG. So I told you this is taken up by the cells by the glucose transporters. Normally this is happening. So what happens in highly infected cells, highly proliferative cancer cells, there is also increased uptake of 2-DG. Let's see the mechanism here. 2-DG is going to inhibit your glycolysis. It's going to deplete your ATP synthesis. So there will be low ATP-AMP ratio. So low ATP, more AMP will be there. Similarly, glucose is deprived. It leads to reactive oxygen species formation. When RO is there, it leads to oxidative stress to the cells. So this will activate your AMP kinase. So when AMP kinase is activated, it will automatically lead to what is known as your autophagy of your cells. Okay. Now this picture was also taken from one of the journals. Let's see what happens in normal cells and what happens in cancerous condition. Okay, so glucose is entering your cell through the membrane, through the GLUT transporters. Glucose is converted to glucose 6-phosphate to fructose 6-phosphate to pyruvate, and it's going to enter your electron transport chain and it's going to give energy. In anaerobic condition, it's going to convert it to lactate and energy is produced. Now what happens when there is more energy is produced, more invasion, more angiogenesis, that is new blood vessels are formed more and more, immunity is less. This is what happens in your cancer condition. There is proliferation of the cell, there is increased blood supply, increased invasion into tissues, and immune activity is less. Because your glucose is available more and more, this happens, and whether there is a low oxygen content in anaerobic condition also, it is converted to lactate and energy is produced. So this happens in your cancerous condition. Now what happens when 2-deoxy-D-glucose is given? It's also entering the cell through your GLUT transporters, and it is converted to 2-deoxy-D-glucose 6-phosphate, and here glycolysis is arrested at this particular step. So what happens? This 2-deoxy-D-glucose is inhibiting the N-glycosylation and leading to stress in the endoplasmic reticulum and ATP depletion, leading to cell death. Finally, cell death is happening. And there is also this glycoprotein modification is also there. That is, the viral particles, infective viral particles are converted to non-infective virions so that they are not capable of transmitting the disease or the virus. Okay. So here this is one of the pictures which showing here SARS-CoV-2 virus infection is there. The stains, you can see the pink color shades, that is your infected cells. Here the second and third picture, you cannot see the infected cells because all these cells are dead after administering your 2-deoxy-glucose. So these are some of the studies showing the use of 2-deoxy-D-glucose which induces oxidative stress and cell killing. There is another study also, it's used in colon cancer as a potential therapeutic drug, 2-deoxy-D-glucose. So the Drug Controller General of India has approved this drug as an oral form. It is not an injectable form. It is an oral form. It is available in a powdered form. In sachet, it is to be dissolved in water and taken. It is only used as an adjunct therapy. Mind it is not the treatment of choice. It is used as an adjunct therapy in moderate to severe coronavirus patients. So it is a generic molecule. It can be easily produced and available in enormous amount. So trials have shown that people who have used this are recovering faster, and supplemental oxygen dependence is also low. So higher proportion of the patients treated with 2-DG showed RT-PCR negative conversion in COVID patients. So this comes in powdered form. We have seen it. What happens? Whatever is there, it accumulates in the viral infected cells and prevents the virus growth, stops its synthesis. There is no energy production also. So there is finally what happens? Killing of the viral infected cells. So this also we have seen already. It interferes with your N-link glycosylation, converting your viral glycoproteins to non-infective viral particles. It acts as a cytotoxic agent by enhancing the oxidative stress. So to summarize, 2-deoxy-D-glucose is going to show is found to show very great improvement in the recovery of COVID-19 patients, and it is also found to reduce the oxygen dependence in mainly in ICU setup patients. So this drug is not come into use yet. It is about to come in month or two. So this video is mainly an educational video for students and children to learn about the 2-deoxy-D-glucose, a new molecule which is not actually a new molecule. It is already there for cancer patients, and now they are trying it out in COVID-19 patients. Okay. Thank you.